I don't think wait. ได้
Blackheads, medically called open comedones, are not dirty pores, but the visible endpoint of a follicle plug that forms when sebum, skin oil, and dead skin cells compact inside the opening of a hair follicle. Because that opening stays exposed to air, the surface of the plug oxidizes and darkens, creating the black appearance, even though the material inside is usually pale and waxy. So, preventing blackheads is not about scrubbing harder, stripping oil aggressively, squeezing constantly, or chasing frequent extractions, but about creating a stable follicle environment that sheds normally, clears normally, and stays calm enough to tolerate consistent preventive care. The guidance here is general educational information, not a personal medical diagnosis. So if you have severe pain, deep nodules or cysts, frequent infections, significant scarring, or acne that is rapidly worsening, it's safest to get individualized evaluation from a qualified clinician because those situations can require prescription treatment and because other skin conditions can mimic acne. The most important principle for prevention is consistency over intensity, because comedones develop gradually and clear gradually. A routine performed gently and repeatedly for weeks and months changes the follicle environment, while a routine performed aggressively for a few days usually creates irritation, disruption of the skin barrier, and rebound oiliness, which worsens congestion. In practical terms, your skin clears best when it is calm, and calm skin is created by gentle consistency, not harsh cycles of deep cleaning. Set expectations that protect your consistency. Pores are normal anatomy and cannot be erased. Your goal is to keep them clearer and less inflamed so they look smoother and less prominent. Many tiny dots on the nose and central face are sebaceous filaments, which are normal oil structures within pores that refill quickly, so the realistic goal in those areas is often less visible rather than gone forever. And repeatedly squeezing or using pore strips can injure the pore wall, spread inflammation, and create lingering redness or dark marks that make texture look worse, even if the pore looks temporarily empty. A simple way to understand prevention is input load versus clearing capacity. Follicles clog when the daily load of oil, sticky dead cells, product films, sweat, friction, and occlusion exceeds the skin's ability to shed and clear. The clearing capacity drops when the barrier is dehydrated, disrupted, or inflamed. Therefore, prevention means lowering the daily load and improving clearing while avoiding irritation that reduces clearing capacity. You can do this without complicated routines by controlling 4 variables. 1. Remove daily films thoroughly at night without friction. 2. Normalize cell turnover inside follicles so plugs don't compact. 3. Support the barrier so inflammation stays low and you can tolerate effective actives consistently. And 4. Reduce daily congestion triggers from occlusion, friction, sweat, and residue. Begin with cleansing because blackhead routines most often fail at one of 2 extremes, under-cleansing or over-cleansing. Under-cleansing is common when people use water-resistant sunscreen, tinted sunscreen, long-wear foundation, setting sprays, heavier moisturizers, or hair products that migrate onto the forehead and then wash quickly with a foaming cleanser. The skin may feel less oily, but a thin film can remain, especially around the sides of the nose, under the jawline, under the chin, around the mouth, and along the hairline where people cleanse less thoroughly. That film behaves like a sticky layer at the pore opening, trapping oil and dead cells, encouraging them to compact, and creating the steady background congestion that produces blackheads. Over-cleansing is the opposite trap. Hot water, harsh detergents, strong foaming cleansers used too frequently, gritty scrubs, cleansing brushes, repeated deep clean steps, frequent alcohol-based toners, and aggressive rubbing can disrupt barrier lipids and proteins, increase transepidermal water loss, cause stinging and redness, and create chronic low-grade inflammation around follicles. Inflamed skin sheds less evenly, becomes more reactive, and in some people, produces rebound oiliness, creating the frustrating pattern of being oily and sensitive at the same time and clogging more easily, which then triggers even more aggressive cleansing, perpetuating the cycle and reducing tolerance for the ingredients that actually prevent comedones. A prevention-friendly cleanse aims for clean and calm, not squeaky. Use lukewarm water rather than hot. Choose a gentle cleanser that leaves skin comfortable rather than tight. Cleanse with fingertips and light pressure rather than abrasive tools. Massage the cleanser for about 20-30 seconds, focusing on typical congestion zones like the nose and sides of the nose, the chin, jawline, and forehead. Rinse thoroughly. Pat dry rather than rubbing. Remember that more pressure and more friction do not equal better cleansing, and repeated friction around follicles increases inflammation and decreases your skin's ability to shed in an orderly way. At night, if you wear sunscreen daily, strongly recommended, or makeup, remove films smarter, not harder. Use a first step remover that dissolves sunscreen and makeup film so you do not need friction, then follow with your gentle water-based cleanser. The first step can be an oil cleanser, cleansing balm, or micellar water. If you use micellar water, saturate the cotton pad fully, press and hold briefly over heavier product areas. Rather than scrubbing, wipe gently, then rinse or follow with a gentle cleanser to remove residual surfactants that can irritate. If you use an oil cleanser or balm, apply to dry skin, massage lightly, then emulsify with water until it turns milky and rinses clean, then follow with your gentle cleanser so you do not leave residue behind. Because some people are prone to congestion from leftover residue, especially around the nose and hairline. Avoid making physical exfoliation, gritty scrubs, rough washcloth friction, stiff brushes, your main pore strategy. It can temporarily smooth the surface, but repeated micro-irritation and swelling around the follicle opening often worsen long-term congestion and reduce tolerance for leave-on actives that prevent microcomedones. Morning cleansing should be individualized. If you wake up oily, sweat at night, used heavier nighttime products, or consistently see clearer pores with a gentle morning cleanse, cleanse lightly. If your skin is sensitive or easily irritated, a water rinse or very mild cleanse may be enough as long as your evening cleanse reliably removes sunscreen and daily film. Either way, avoid starting the day with a tight, stripped feeling because barrier stress early often leads to more oiliness and reactivity later. The second pillar is barrier support through moisturizer, even if you are oily, because skipping moisturizer often backfires. A dehydrated or compromised barrier becomes reactive, sheds unevenly, and tolerates effective actives poorly, leading to stop and start routines that never change the follicle environment long enough to matter. Barrier support is prevention biology because calm, hydrated skin sheds more normally and is less inflamed around pores, reducing the tendency for material to compact and improving the appearance of texture. Choose a lightweight, breathable moisturizer rather than a heavy, waxy layer if you are clog-prone. Ingredients that commonly support barrier function include glycerin, hydrain, ceramides barrier, lipids, panthenol, soothing support, hyaluronic acid, water-binding hydration, and in many people, niacinamide, barrier resilience, and reduced redness. Apply a thin layer after cleansing, ideally while the skin is slightly damp. Keep the layer lighter on the T-zone. If you get shiny easily and slightly more generous, where you feel tight, but do not eliminate moisturizer entirely, because comfort is what allows long-term consistency with preventive steps. The third pillar is daily sunscreen. UV exposure drives inflammation and long-term collagen breakdown that can make pores appear more prominent over time, and sunscreen is essential if you use exfoliating acids or retinoids because those can increase sun sensitivity. Consistent sun protection also reduces uneven tone and lingering marks that make texture look worse. Use broad-spectrum SPF 30 or higher daily. Apply generously and evenly, and reapply during prolonged outdoor exposure. If you sweat heavily, recognize that sweat plus sunscreen plus occlusion can increase congestion, so rinse or cleanse when possible and reapply rather than letting sweaty sunscreen sit for hours. If sunscreen feels greasy and makes you want to skip it, treat that as a formula fit problem rather than a reason to abandon protection. Lighter fluid, gel, and oil control formulas exist, and many sunscreen clogs me situations improve when the formula is changed and nighttime removal becomes more thorough rather than when sunscreen is avoided. After the basics, gentle cleansing, moisturizer, sunscreen, are stable. Blackhead prevention is driven by 1 or 2 proven actives, used patiently at a frequency you can tolerate long-term. The most practical, evidence-supported categories for comedonal congestion are salicylic acid, BHA, and topical retinoids. The most common reason these fail is not that they do not work, but that they are introduced too aggressively, too strong, too frequent, stacked with multiple other actives, leading to irritation. Irritation makes shedding chaotic, exaggerates texture through dryness and redness, and forces breaks, and breaks reset progress. So introduce slowly and prioritize comfort. Salicylic acid is oil-soluble, meaning it can penetrate into the pore lining where oil accumulates. It loosens compacted dead cells and sebum, reduces the stickiness of shedding inside follicles, and helps prevent microcomedones from becoming visible blackheads. For prevention, a leave-on salicylic acid product in the 0.5% to 2% range is common. Start low and slow. Apply 2 nights per week for the first 2 weeks, then increase to 3 nights per week if your skin remains comfortable. Move toward every other night, only if needed and well tolerated. Apply at night to clean, completely dry skin, because damp skin can increase stinging, then moisturize. If you are sensitive, buffer by applying a thin layer of moisturizer first, then BHA, then moisturizer again, or apply BHA only to the most clog-prone zones, often nose and chin, rather than the entire face. If persistent stinging, redness, or flaking continues beyond a short adjustment period, reduce frequency and rebuild tolerance rather than pushing harder, because irritation undermines prevention. A salicylic acid cleanser is an alternative for very sensitive skin. Shorter contact time can be gentler, but leave-on products often work better for stubborn congestion because they have more time to act inside the pore lining. Either approach can work if it is consistent and does not inflame the skin. Retinoids are the other cornerstone because they normalize how skin cells mature and shed inside follicles, reduce microcomedones, the invisible precursors of blackheads, and improve texture over time. They prevent new clogs more than they pull out old ones, so patience matters. Over-the-counter adapalene 0.1% is commonly used in many regions. Stronger retinoids may require prescription depending on where you live. Retinoids work best with a low and slow approach. Use a pea-sized amount for the entire face, not a pea per zone. Applied at night to completely dry skin. Start 2 nights per week for 2 weeks, then 3 nights per week, then every other night if comfortable. Only consider nightly use if your skin truly tolerates it and you need it. Using more product does not speed results and increases irritation. If you are sensitive or dry-prone, use the moisturizer sandwich method. Apply a thin layer of moisturizer, then retinoid, then another thin layer of moisturizer. Mild dryness or flaking early can happen, but burning, persistent redness, cracking, or raw tightness means you are going too fast. So reduce frequency, add moisturizer-only nights, and rebuild tolerance. If you want to use both BHA and a retinoid, do not start them together, and do not layer them on the same night initially. Introduce one active, stabilize tolerance for 3 to 4 weeks, then add the second on alternate nights. A simple schedule many people tolerate is retinoid on Monday and Thursday, BHA on Tuesday and Friday, and moisturizer only on the other nights. Later adjust based on comfort and results. Many people do best long-term with the retinoid as the anchor and BHA as a targeted booster once or twice, weekly on the nose and chin. This addresses both follicle shedding pattern, retinoid, and oily pore environment, BHA, while minimizing irritation. And it is usually better to be slightly undertreated but consistent than overtreated and inflamed. Supportive ingredients can help comfort and reduce inflammation without complicating the core plan. Niacinamide, often 2% to 5%, can support barrier resilience and reduce redness in many people. Azelaic acid can help inflammation and uneven tone and is often well tolerated. If you also have inflammatory pimples along with blackheads, benzoyl peroxide can help reduce inflammatory lesions, but it is less directly focused on blackheads than BHA, retinoids, and can be drying. So consider a cleanser format a few times weekly or targeted use, rather than stacking multiple strong leave-on actives while building tolerance. One of the most important prevention skills is recognizing when you are doing too much, because overloading is the most common reason prevention fails. Too many actives, too frequent exfoliation, too much friction, and constant product switching create irritation. Irritated skin sheds unevenly, looks rougher, makes pores appear larger, and becomes less tolerant of effective products. So progress becomes a cycle of bursts and setbacks. Prevention works best when your skin feels mostly calm most days, and your active schedule is predictable and tolerable. If moisturizer stings, if your skin feels persistently tight or raw, or if redness lasts beyond a day, pause actives for several nights, return to gentle cleansing and moisturizer only, then restart at lower frequency. Beyond products, blackhead prevention depends heavily on friction, occlusion, sweat, and residue management, because these factors trap heat and oil, increase swelling around follicles, and encourage plugs to form. If you wear masks, helmets, chin straps, or anything that rubs the same area repeatedly, keep contact surfaces clean, reduce friction with a light moisturizer, and cleanse after prolonged wear when possible. Avoid heavy ointments in areas that will be occluded for hours. After heavy sweating, rinse or cleanse as soon as practical, and reapply sunscreen if it is daytime. Do not let sweat and sunscreen sit for hours if you can help it. If you cannot cleanse immediately, even a gentle rinse and blot reduces congestion load. Hair products are a frequent hidden trigger, especially along the forehead and temples. Pomades, waxes, heavy oils, and leave-in conditioners can migrate onto facial skin. Keep styling products off the forehead. Wash the hairline thoroughly at night. Avoid oily bangs resting on the forehead, and wash hands after applying hair products so you do not transfer residue to cheeks and chin. Environmental contact surfaces matter too. Pillowcases collect oil and product residue, so change them at least once or twice per week, more if very oily. Clean your phone screen regularly. Wash makeup brushes and sponges weekly. Avoid using the same face towel repeatedly without laundering. These steps reduce background congestion that can keep pores clogged even when your skincare is otherwise good. Product selection should be practical rather than fear-based. Non-comedogenic labels can help, but are not a guarantee. Focus on lighter textures for clog-prone zones. Avoid stacking multiple heavy products on the T-zone. Remove sunscreen and makeup thoroughly every night, and introduce new products one at a time so you can identify triggers. If a new product correlates with increased congestion after 2 to 4 weeks, stop it and reassess rather than adding more actives on top. Avoid squeezing and picking because trauma can push material deeper, injure the follicle wall, spread inflammation, and increase risk of lingering redness or dark marks. Repeated picking can also make pores appear more prominent over time. If you tend to pick, reduce triggers by keeping nails short, avoiding magnifying mirrors, limiting skin checking to once daily in normal lighting, keeping hands busy, and using simple patches on areas you touch. If a specific blackhead truly bothers you, professional extraction can remove it with less trauma, but extraction alone does not prevent recurrence maintenance with BHA. Retinoids does. Be cautious with pore strips and aggressive peel-off masks. They can remove superficial material, but often irritate the skin and do not address deeper microcomedones, leading to rebound congestion. Clay masks can help very oily skin absorb surface oil and reduce shine, and once weekly can be reasonable, but overuse can dry